Hey, it's Adam Sewell, MD. Welcome to Module 4 of the Microplastics Toxicity Training, certified by the Microplastics Health Alliance. In this section, we're going to focus on something that every clinician, regardless of specialty, needs to master: recognizing the clinical presentation of microplastic toxicity. As we covered in Module 3, microplastics can enter the human body through ingestion, inhalation, or even through the skin. But the real challenge for clinicians is identifying how these exposures show up in the form of patient complaints, symptoms, and laboratory abnormalities. And unlike acute toxic exposures like lead or mercury, microplastics produce a slow, insidious burden on the body. Their effects are often non-specific and diffuse, so the key is pattern recognition. Part 1, Symptom Clusters, the clinical fingerprint of microplastic burden. Let's start with the 5 major domains where microplastic-related symptoms tend to cluster: gastrointestinal, neurological, hormonal, dermatologic, and systemic. Gastrointestinal (GI) symptoms. Patients often report chronic bloating, intermittent constipation, or loose stools, increased food sensitivities, or unexplained nausea. These symptoms likely reflect microplastic-related gut inflammation, dysbiosis, and increased intestinal permeability. In an animal study by Wei-Xuan Su et al., polystyrene nanoplastics were shown to disrupt the intestinal microenvironment by altering bacteria-host interactions through extracellular vesicle-delivered microRNAs. Neurological and cognitive symptoms. Microplastics and their associated chemicals, like BPA and phthalates, can cross the blood-brain barrier and activate microglial inflammation. Common complaints include brain fog, poor memory recall, irritability, anxiety, sensory sensitivity, and sleep disruption. Patients with significant burden may also report dizziness, lightheadedness, or difficulty concentrating in environments with fluorescent lighting or high electromagnetic fields. Hormonal symptom. Microplastics act as endocrine disrupting agents. BPA mimics estrogen, and phthalates block testosterone production. Women may present with irregular cycles, heavy or painful menstruation, fibroids, endometriosis, or infertility. Men may experience reduced libido, erectile dysfunction, low testosterone, or gynecomastia. You may also see secondary hormonal effects, like altered thyroid function, adrenal fatigue, or insulin resistance. Dermatologic symptoms. Patients often overlook this domain, but chronic exposure to microplastics has been linked to eczema, urticaria, chemical sensitivity, and flares of psoriasis or acne. These may be related to immune dysregulation, mast cell activation, and accumulation of toxins in subcutaneous fat. Systemic and non-specific complaints. This is where things get tricky. Many patients present with fatigue, sluggishness, unexplained weight gain or loss, chronic pain, and a general feeling of being unwell. These symptoms are easy to dismiss or misattribute, which is why this training is so important. Part 2, Patient Profiles and Phenotyping. Let me give you a few example patient profiles we often see in clinical practice. A 32-year-old female with no known autoimmune disease, but reports worsening premenstrual syndrome, bloating, fatigue, and chemical sensitivity. Labs show normal CBC, but borderline low progesterone and elevated sex hormone binding globulin. You find she's using plastic Tupperware daily, microwaving in plastic, drinking from plastic bottles, and using synthetic skincare products. A 41-year-old male executive presents with brain fog, low libido, and rising triglycerides despite regular exercise. His testosterone is 280 nanograms per deciliter, estradiol is 38 picograms per milliliter, and urinary BPA is elevated. He drinks 5 bottles of water per day from soft plastic and uses a vinyl floor mat in his home gym. These aren't just lifestyle complaints, they're environmental toxicology cases hiding in plain sight. We need to start thinking in terms of toxic burden phenotypes. Not every patient with microplastic exposure will show the same symptoms. Some may lean neurocognitive, others hormonal, others immunologic. This is why symptom clustering is so important in your diagnostic process. Part 3, Supporting Literature and Clinical Validation. Let's anchor this in published data. In a 2018 study by Sewell et al., microplastics were found in the stool of every human subject tested. All were asymptomatic volunteers, suggesting the burden is widespread and subclinical in many patients. The WHO's 2019 report on microplastics in drinking water emphasized that although acute toxicity is unlikely, chronic low-level exposure is almost universal and poorly understood. Leslie et al. In 2022 confirmed microplastics in human blood in 80% of tested individuals. highlighting the systemic absorption and circulation of these materials. While randomized controlled trials on symptom resolution post-exposure reduction are still emerging, clinical experience and mechanistic studies suggest a direct link between plastic burden and these clusters of dysfunction. Part 4. The MHA screening tool, bringing structure to your evaluation. To help clinicians systematically assess for microplastic toxicity, the Microplastics Health Alliance has developed a validated clinical screening tool. This tool evaluates exposure patterns, symptom clusters, and known risk factors, and then provides a standardized risk score. Here's how it works. As a physician, you can create a free account on the MHA website. From your dashboard, you can send a secure, HIPAA-compliant link to your patients. The patient completes the survey on their own device, and the results are automatically transmitted back to both the patient and your account. The score is color-coded into low, moderate, and high risk for microplastic-related toxicity. This screening tool is designed to fit into your workflow. You can send it ahead of a new patient consult or integrate it into your functional medicine or integrative intake protocols. It gives you an immediate data-backed window into the environmental factors that may be driving your patient's symptoms. And for patients who are already symptomatic, it helps quantify burden and prioritize treatment, even when labs are pending or inaccessible. So to summarize, microplastic toxicity presents as a constellation of vague but persistent symptoms across multiple systems. As clinicians, we need to become experts at pattern recognition, looking for those combinations of fatigue, brain fog, hormone imbalances, GI symptoms, and chemical sensitivity that point to environmental burden. We also need to use tools like the MHA clinical screen to gather data, track changes over time, and support our diagnostic reasoning. In the next section, we'll go over how to take a focused environmental exposure history, including the high-yield questions you should be asking every patient. Let's keep building your clinical toolkit. I'll see you in section 4.2.